Hey y'all, it's me, Dr. BMD, and I'm back with a super brief video. I've recorded this like 3 times, so this is my last time. We got to go with this one. I don't know how y'all influencers do these videos. So I decided to do this video today about gout. I had a friend that called me over the holiday season. They were having a gout flare. Surprise, surprise, right? A lot of the things that are ingested over or associated with the Easter holiday would be things that might increase uric acid, which is a protein byproduct. Let me bag up. So gout, first and foremost, is an inflammatory disease. It's an arthritis, a type of arthritis that can affect the joints. Most specifically, we think about gout affecting the base of the great toe, big toe. We call that podagra, is usually the way that presents. So like most arthritides, it presents with pain, sometimes with swelling, erythema, tenderness of the joint, right? And it doesn't just have to be the big toe. Gout can affect small and large joints. It's a chronic illness that frequently will have acute presentation. So you may get a gout flare and you chronically have gout, right? So to some extent, it's a metabolic disease, as I mentioned before, and it needs to be managed in 3 ways. Usually with medicines that decrease the uric acid, which is a byproduct. We'll think about it as a byproduct of protein metabolism, right? We need proteins. They're the building blocks of our muscles and other things, right? We need those for all the different processes that our body undergoes that keeps us alive, happy, and healthy. So the friend had a gout flare. I'm sure it was associated with ingesting red meat, organ meats. Lamb is a big thing during this holiday, as well as maybe even alcohol consumption. So like all chronic illnesses, they have to be managed, again, typically with medication. Gout medicines decrease uric acid. Secondly, with the dietary component, which is really a large component. And then we can add exercise because it is an arthritis, right? Or arthritis. So as I was talking to them about ways in which they could decrease their gout flares, I was reminded of something that I'm always confronted with as a primary care physician, that frequently patients don't have the tools that they need to make great decisions, right? So as a physician, a lot of what we're doing, clinicians, my sister's a dentist, same thing, pharmacists, nurse practitioners, we should be educating the people who are relying on us for information, right? Not just regurgitating things, but giving them digestible information that can help them change their life. That's what we're here to do. And so one of the things that I think is not done enough is reviews of food as being medicine, right? So reviewing with patients the choices that they're making and the outcomes of those choices. So with that in mind, I decided, I'm in my kitchen, as you can see, and so I decided to pull out a lot of things in my cabinet as I was talking to that person about gout and trying to encourage them to let them know they already have the tools in their home. They're already at their disposal. And these are things that are overall good for their health, good for their body, good for their skin, good for their hair, good for their sexual health, which is a big thing, right? Because frequently we see gout associated, or we see that there can be some associated or some tandem chronic kidney disease and some reproductive, genital reproductive issues, which most folks don't want to have any sexual dysfunction. Okay, so let's back up. So I went through 10 things that they could do, or 10 food groups that they should really be leaning in on to help manage their gout. And so I'm going to try to do that real quickly, hopefully within 2 or 3 minutes. Because this video is already running long. And so the importance of this, I think, is great. I talked to an old friend before about doing something like this with their parishioners, but we never really worked that out or figured out how to make that work. So I decided that I'll do this as a video. Depending on the interest, I might do others. So when we think about gout, like I said, I'm going to do 10 things. There are definitely more than 10, but this is what I had. And this is a good base. So the first thing we want to think about are nuts and seeds. So nuts, walnuts are great. Omega-3 fatty acid rich, great source of protein. If you're a person that likes plant-based protein, you can soak walnuts, and they're a good meat, beef, or turkey substitute ground. Another nut that's a great nut is going to be almonds. I am lactose intolerant, so I do nut-based milk, so I have all types of nuts here. This is I have this as seeds. These are pumpkin seeds. Not necessarily that great for gout, so let me bag up off of that. So when we think next about seeds, flax seeds, great. Chia seeds, also great. Now remember that there are specific ways in which you need to ingest intake and manage these things. So you need to educate yourself about how to use these. This video is not that. So chia seeds, importantly, are great, as are the nuts as well, for fiber, as I mentioned, which does what? Decreases glucose spikes, helps you feel full, has a digestive benefit, and decreases inflammation, and gout is an inflammatory process. So next up, we'll go to veggies, and I don't have any fresh broccoli, green cruciferous vegetables are great. Green beans is another thing that would be a good idea as far as veggies are concerned. Low fat dairy, so that's going to be Greek yogurt, which is just great, a great source of protein, tons of proteins in Greek yogurt. Also calcium. Those things are going to be good to combat frequent gout flares. This is the Greek yogurt that I really like, but the plain Greek is probably the best one for you to think about. Cottage cheese is also a very good dairy product to include. You can use cottage cheese as a bread substitute even. So next up, I think we're at about 6 or 5. It's going to be eggs. So eggs are a protein source that actually don't increase uric acid protein like red meat and those type of or end organs and those types of meats do. So that's a good source. The next is going to be plant-based, and I thought I pulled out some tofu, but apparently I don't have it out here. Tofu is a great source of plant-based protein, as are some of these nuts, as I mentioned before. Next up is going to be whole grain. That's going to be quinoa, just your regular quinoa. I also do a tricolor quinoa that I get from Trader Joe's. That's going to be barley, your brown rice. Those kind of things are going to be great. Next is going to be legumes. I pulled some kidney beans, some black beans, and the king among beans, lentils. Great source of protein, great source of fiber. Just great, 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 great. I also didn't realize I had some hemp hearts here. So also chickpeas, pinto beans, but you know, not bad. And then I didn't mention oats with the whole grains, which was number 8, I believe. Black coffee is proven to be good for folks with gout. Black coffee, no additives. And so this is Ethiopian coffee I have, but you have to drink so many cups. I think it's like 3 to 5 cups. So I don't encourage patients to do that because that caffeine can cause other things. But if you're a coffee drinker, know that if you're drinking it black, it's not likely causing any increase in uric acid production, i.e. gout flares. Next is going to be good healthy fats in terms of oils. So Graza is an olive oil that I like, as well as I buy the big olive oil from Costco. And then I'm reaching over to my stove. This is a really high quality olive oil that I use to cook with, as well as avocado oil. Those are going to be good oil choices as opposed to like seed oils. Well, avocado is a seed oil. Well, seed oil, I mean in like canola and that sort of thing, which aren't good. Another good thing is going to be protein sources like fish, which I was having tuna today, tuna, mackerel, even sardines to some extent. But I mean, not sardines, anchovies or sardines could be as well, are going to be good sources. So white meat over red meat, I'm sure someone has talked to you about that if you suffer from gout. No organ meats. Organ meats are the enemy of gout control. And then the last one is going to be fresh fruit, which I don't have here. Clinically, cherries are proven to be very good for folks with gout. And some folks do cherry extract or cherry juice. I like dark cherry juice as well. I'm not a gout sufferer, but you have to be mindful that cherries do have a high glycemic index. So if you're a diabetes sufferer, you got to be careful with that. Of course, like anything, these are conversations for you to have with your primary care provider. Engage them in conversations that you think could lead to a better management of your chronic illnesses and your overall health, because that's what it's all about, right? When you go in to see your primary care provider, you should have a list, or it doesn't have to be on paper, but a mental list or something that you want to talk about, because you need to take that point to get educated about something that you are dealing with, whether it be a physical or a clinical presentation or a clinical illness. So engage your providers and make that time work for you. Hope this was helpful.